Hi, my name is Dr. John Paul Gallardo, and I frequently get asked, whether a deep cleaning or scaling is better than Lanap, or whether Lanap is better than the traditional surgery, and so forth. So what's important to understand is that periodontal disease, which is really the silent killer of teeth, that's why people lose most of their teeth nowadays. Periodontal disease is really considered to be two things, or at least we have to focus on two things, two major categories. One is infection. Does the patient have active infection or not? And we know that through DNA testing, microscope examinations, and presence or absence of inflammation and bleeding. So that's yes or no. Two is, does the patient have damage caused by that infection? Because both of these things are really different elements in terms of treatment, if you consider that. Scaling and root planing is only going to get so far underneath the gum line. If the infection has caused damage to the seal of the gum line up against the tooth, then the point where the seal joins the tooth is going to be further down. If it's too far down to maintain, then that bacteria is going to keep accumulating. So treatment is all based on basically access, being able to get to all the infection. And the worst bacteria is sitting at the base of the pocket, not on the surface. So I would say Lanap, which stands for Laser Assisted New Attachment Procedure, is the ideal treatment choice. Why? Because the Lanap procedure, unlike scalpel surgery, which is the traditional type of surgery, the Lanap is basically like a heat-seeking missile, if you think about it. The energy is going to be absorbed in anything that has pigment. So things that have pigment, or things that are a little bit darker, would be the bacteria, the tartar sitting on the root surface, and the inflammation. So if we're eliminating these elements, but knowing that the laser is not necessarily going to damage healthy tooth structure, bone, or tissue, then we're good, because that laser is going to eliminate all of the infection, even in the sites that haven't really deteriorated that much. So all around, Lanap is something that I've seen time and time again give us the best results. I hope that helps.